We're going to move along here with our designation of the Airborne Infectious Disease Exposure Prevention Plan. So the New York State Department of Health has designated COVID-19 as a risk-presenting, highly contagious communicable disease. So what does that mean? With the New York State Commissioner of Health designated COVID-19 as an airborne infectious disease that is highly contagious, presenting a serious risk of harm to the public health, this means that Global Concepts Charter School's Airborne Infectious Disease Exposure Prevention Plan has been activated. So we'll touch base on the signs and symptoms of COVID-19. So from the CDC, they state that the symptoms of COVID-19 can include the following. So that's cough, sore throat, fever, muscle pain, chills, shortness of breath or difficulty breathing, or new loss of taste and smell. The CDC states that symptoms can range from mild to severe illness and appear 2 to 14 days after you are exposed to the virus that causes COVID-19. They do recommend that you seek medical care immediately if you have emergency warning signs of COVID-19. So those are listed as follows: trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, pale, gray, or blue-colored skin, lips, or nail beds, depending on skin tone. So how can COVID-19 spread? So according to the CDC, COVID-19 spreads when an infected person breathes out droplets of very small particles that contain the virus. The World Health Organization, or the WHO, recommends avoiding the 3 C's. So number 1, that's your crowded places with many people nearby. Number 2, your close contact settings, especially where people have close range conversations. Number 3, your confined and enclosed spaces with poor ventilation. Please keep in mind that the risk is higher in places where all of these factors overlap. So Global Concepts Charter School Exposure Control Plan. So these are our minimum controls. Our first one here, our general awareness. So that's maintaining physical distancing, exercising, coughing, and sneezing adequate, wearing face coverings, gloves, and PPE as appropriate, limiting what you touch, stopping social etiquette behaviors such as hugging, handshaking, etc., washing your hands properly and often. Our stay-at-home policy: if an employee develops symptoms of COVID-19, they should not be in the workplace. The employee should inform the school nurse if symptoms appear, and they should be following New York State Department of Health and CDC guidance. Health screening: employees will be screened for COVID-19 at the beginning of their shifts. Employees should continue to monitor for COVID-19 symptoms throughout their shift and should contact the school nurse if there are any new or emerging symptoms. So continuing on here, physical distancing. Global Concepts will be limiting visitor entry into each worksite building, configuring workspaces, promoting remote meetings, limiting occupancy in certain areas of the buildings, example break rooms, posting floor markings and signs, preventing gatherings in the buildings, and adjusting break times and lunch periods. Hand hygiene. Global Concepts is promoting hand hygiene through the addition of hand sanitizing stations and/or hand washing stations throughout the building. Global Concepts encourages employees to wash their hands with soap and water for at least 20 seconds or use hand sanitizer with at least 60% alcohol to clean your hands to prevent the spread of COVID-19. Faculty and staff should wash their hands or use hand sanitizer before and after touching eyes, nose, and mouth, touching your mask, and touching commonly touched surfaces, example phones, handrails, doorknobs, etc. Respiratory etiquette: employees should cover their faces when coughing, sneezing, and yawning to prevent the spread of COVID-19 through droplets expelled from the mouth and nose. For any special accommodations, please reach out to the Human Resources Department if you fall within this group and need an accommodation. So advanced controls during the COVID-19 outbreak. Global Concepts Charter School will determine if the following are necessary and are subject to change on operations and circumstances surrounding the COVID-19 outbreak. Global Concepts may consider the temporary suspension or elimination of potentially hazardous activities where minimum controls cannot provide employees with sufficient protection against COVID-19. So example here, limiting or eliminating altogether in-person instruction, limiting gatherings by location and scales. So that's moving your gatherings to an outside area and limiting the scale of people. Limiting or eliminating in-person recreational activities, example, sporting events. Global Concepts has increased its engineering controls to contain the COVID-19 virus by preventing COVID-19 from being spread and isolating workers from COVID-19. Engineering controls include, but are not limited to, mechanical ventilation, so those are your local ducts, general ventilation, so increasing the percentage of fresh air introduced into the air handling systems and avoiding air recirculation. Your natural ventilation, so that's your open windows, opening windows on one side of the rooms with fan in use on the other side of the room as applicable, and hand washing stations and hand sanitizing stations. Administrative controls and PPE. So Global Concepts has done the following to promote administrative controls and will continue to do so with regards to the New York State Department of Health and CDC guidance. So we've increased space between employees and students, instilled disinfecting procedures for all building operations, rearranged traffic flow in the buildings, required health screenings for students, faculty, and staff upon entry into the facilities, and limited attendance of in-person meetings. Global Concepts will further consider appropriate policies and work rules to aid in preventing exposure to COVID-19. Global Concepts will continue to follow New York State Department of Health and CDC guidance in regards to PPE. So that means all faculty, staff, and students, regardless of vaccination status, are required to wear face coverings in the school buildings. Masks can be taken off for meal periods, and masks should be worn to cover both the nose and the mouth. So our infections response during the COVID-19 outbreak. If an actual or suspected COVID-19 case occurs at work, Global will take the following actions. So we will instruct the individual to wear a face covering and leave the worksite and follow current New York State Department of Health and CDC guidance. The school nurse will be informed and the individual should follow procedures laid out in Global Concepts Charter School's COVID-19 containment, testing, and contact tracing plans. We will follow local and state authority guidance to inform impacted individuals. Activities and locations at Global that may involve exposure to COVID-19. So activities and locations may include, but are not limited to, gatherings in any area of the worksite, including but not limited to break rooms, restrooms, etc., not wearing masks or protective equipment at any worksite, not maintaining physical distance in the classrooms or other work sites, and not monitoring your health for any new or worsening symptoms of COVID-19. The use and limitations of exposure controls. So these are subject to change based on operations and circumstances surrounding COVID-19 as per the New York State and Erie County Department of Health and CDC requirements, guidelines, and operations. Global Concepts Charter School will review and revise the plan periodically throughout the designation of this plan and as often as needed to keep up to date with current requirements. So overall here, your employee rights under Sections 218B. Employers cannot discriminate, threaten, retaliate against, or take any adverse action against employees for 1. Exercising their rights under the Act or the employer's plan. 2. Reporting violations of the Act or the employer's plan to officials. 3. Reporting or seeking assistance for an airborne exposure concern to an employer or official entity. Or 4. Refusing to work when the employee, acting in good faith, believes that dangerous exposure caused by working conditions inconsistent with laws or the required safety plan exists, with certain exceptions. Lastly, here from the CDC, some guidance to help the spread of germs. So here you can see avoiding close contact with people who are sick, covering your cough or sneeze with a tissue and then throwing the tissue in the trash. Avoid touching your eyes, nose, and mouth. Clean and disinfect frequently touched objects and surfaces. Staying home when you are sick, except to get medical care. And washing your hands often with soap and water for at least 20 seconds.